Hello, let us learn about the key performance indicators of antimicrobial stewardship program. So our objectives will be to discuss the challenges of implementation of AMS, antibiotic formulation, and nursing protocols and molecular approach to antibiotic selection in this session. Let us see about the antimicrobial stewardship team and its responsibility. The team consists of ID physician, the pharmacist, the microbiologist, hospital administrator support, hospital epidemiologist, and inpatient professional. And the rules include to establish an antibiotic formulary, produce antibiotic guidelines, develop and implement educational programs, audit, have surveillance of antibiotic usage, review the interventions, and monitor the compliance. So there are two basic approaches towards AMS, that is front-end approach and a back-end approach. Front-end approach at the end of the prescribing antimicrobial, at the time of the prescribing antimicrobial, which includes formulary restriction, pre-authorization, interactive decision support, and guidelines and set order sets. While the back-end approach is after the antimicrobial has been prescribed, which includes prospective audit, feedback, de-escalation, dose optimization, and IV to oral conversion or broad to narrow spectrum conversion of antibiotics. What are the key elements for successful AMS program? It includes establish compelling need and goals for AMS, senior leadership support, effective local physician champion, adequate resources for the program, like pharmacy, IT professionals, microbiologists, IT professionals. Then primary objective is to optimize the clinical outcomes and reduce adverse events and not reduce costs. They should agree upon the process and outcome measures. What is the antibiotic anarchy in developing country? Is AMS possible? The antibiotic anarchy is as follows. Hospital environment is not conducive, antibiotic protocols are not available or at rudimentary stage or not followed, minimum antibiotic surveillance data and microbiological infrastructure. That's the main issue in developing countries. Antibiotic usage is not based on evidence, only a few qualified ID specialists. Empirical antibiotic usage is not based on microbiological data or evidence. Multiple prescriptions are common. Then we have crowded market and lax regulations. Many generic copies of antibiotics are available. Irrational and combinations are common disease. Indiscriminate promotion by pharma companies. Over-the-counter availability of broad-spectrum antibiotics and high-end antibiotics. Antibiotic resistance is very high. ESBL rate is about nearly 40% in community. Nosocomial ESBL is about 80%. Carbapenem resistance to Pseudomonas and Acinetobacter ranges in 20 to 60%, while MRSA is about 30 to 50%. Main challenge in framing the stewardship project is to understand, to simplify, to operationalize the guidelines, to take stewardship from paper to patient bedside. What are the key performance indicators? This includes structural indicators, process indicators, and the clean outcome indicators. Indicators describe the organization and resources, communication and evaluation tools available at the hospital level for implementing at a multimodal, multidisciplinary stewardship program. What are the top 5 structural indicators? It includes multidisciplinary antibiotic management team, antibiotic drug formulary with annual update of local guidelines, local clinical guidelines for IV to oral switch, from broad to narrow switch. What are the process indicators? Process measures are direct measures of the quality of the antimicrobial prescription, example antimicrobial therapy, prophylaxis, adherence to guidelines. The process measures for evaluating the antimicrobial stewardship include justifications, appropriateness of antibiotic drug choice, appropriateness of antibiotic drug regimes, appropriateness of time of inhalation, initiation of antibiotic therapy, appropriateness of duration of antibiotic therapy, rate of acceptance, rate of adherence, and others. The outcome indicators include clinical outcomes, change in the resting patterns, utilization, and cost outcomes. Now, the best way to showcase the difference in the outcome is to show the pre-AMS and the post-AMS difference. A physician once said the best medicine for humans is to love someone. Asked, what if it doesn't work? He smiled and said, increase the dose. The implemented properly, stewardship will be the antimicrobial stewardship is the aspirin under 21st. Thank you.